afternoon. My name is Lauren Mills, and I'll be completing a newborn assessment today. We have Miss Jane and Jane's mom, Ms. DeJarnett. I would first, before completing my assessment, ensure for privacy and dignity throughout the entire assessment. I would complete my hand hygiene. I'm going to go ahead now and introduce myself to Ms. DeJarnett. My name is Lauren. I'm a nursing student at Germanna, and I'm going to be doing a newborn assessment today. Is that okay?
That's okay.
All right. Can you tell me her name and date of birth?
Jane Doe, 8/24/20.
Excellent. That is correct on the bracelet. Before coming into the room, I looked up her birth history. I see that Miss Jane was born vaginally, no use of forceps, and no trauma. Is that correct?
Yes.
All right. Great. And I would then obtain some vital signs. We're going to first start with respirations that we count for a whole minute. Respirations of 40. We're next going to obtain an axillary temp, which goes right in the middle of the armpit. 98.6. We'll next listen to the apical pulse. To obtain her pulse rate, make sure you warm up your stethoscope prior to placing it on the baby. Again, we're going to listen for a whole minute. Pulse rate of 146. All right. And then I also noted in Miss Jane's chart that she was born at 19 inches, weighing in at 7 pounds. She had a chest circumference of 12 inches and a head circumference of 14 inches. Is that correct, Mom?
Yes.
All right. And if she hadn't have had a chest circumference or head circumference documented, I would measure her chest circumference at the nipple line and her head circumference at the brow line, okay? All right. Moving on, we're just going to assess Miss Jane's appearance. Appearance-wise, she looks well. She's symmetrical. She has good muscle tone on both sides. Her skin, I'm noticing some vernix cosa in the folds of her legs, arms, and her neck. All right, she has a good lusty cry going on. I'm not seeing any of the arrhythmia toxicum. I'm noting some milia along her nose. No petechiae. All right, I'm just gonna keep looking. I'm just gonna fold her around. All right, I'm not seeing any Mongolian spots on Miss Jane. All right, there is that lusty cry. And I am noting a little lanugo along her shoulders and on her back there, okay? All right, so now we'll move on to her head. We're just going to assess the fontanelles. The anterior fontanelle is typically a more triangle shape, while the posterior is a little bit more of a diamond. I'm just looking for any sunken in or bulging areas. I'm assessing the suture lines. She does have a little bit of molding just from being born vaginally. I'm not noting any caput, and I am also not noting any cephalohematoma. That would just be from use of the forceps during labor, and I'm not noting any of that. All right, it looks like Miss Jane's face is symmetrical. She is even on both sides. Her eyes are well formed. I would check her iris color and perla with a pen light. I would see that her iris color is a bluish gray. Her pupils would be equal and reactive to light. They are, however, not accommodating at this point in time. I am noting some strabismus, which is just a little bit of a lazy eye. Again, that's totally normal for this age. And next, I'm just going to assess her conjunctiva. And I am seeing that that is clear, no signs of infection. That is a good sign. We're going to move on to her ears. We're looking to make sure the corner of Miss Jane's eyes line up with the top of her ears, and they do. They are symmetrical on both sides, and they are well formed on both sides. Okay. Next, we're going to move on to her nose. We're just looking for patency of the nares, the little openings there. So they are typically nose breathers when they're born, and we would hear like some grunting and stuff like that. We don't hear anything, just viewing them, they look patent to me. Now we'll move on to Miss Jane's mouth. We're going to go ahead and just palpate the palate for any openings. I'm not noting any. I also don't note any Epstein's pearls, and I'm also assessing her suck and swallow reflex, which is intact. Okay, now moving on. We're going to go down to her neck and clavicle, and we're just assessing. Everything looks good here. And now we're going to go down to her chest. Okay, we're just looking for symmetry, which we have, and we're looking for the nipples, and we'll go ahead and just get her undressed real quick to assess her nipples. I know, just the worst. Nipples are a normal size. All right, and breast buds are approximately 2 millimeters, not milliliters. All right, so now we're going to go ahead and assess her breast sounds. Again, warming up the stethoscope. Do note some crackles, which is normal for this age. Okay, and a vaginal birth. We're going to then, check for her apical pulse again, and we're going to be assessing for a murmur, okay? Apical pulse is 148, no murmur detected. Okay, now we're going to move on to her abdomen. Again, just looking for symmetry. We would see through the cord, we would see two veins and 1 artery. All right, excuse me, 2 arteries, 1 vein. And then we're going to go ahead and we're going to listen for bowel sounds. We're going to go ahead and warm up our stethoscope again. Okay. Bowel sounds are present. Have you noticed any bowel movements, Mom?
Yes.
Yes. Okay. And was it dark and kind of tarry?
Yes.
All right. And any urine output?
Yes.
Okay. Excellent. How many wet diapers has she had?
Several.
Several? Okay. All right. Hard to count. Got a lot going on. All right. So we are going to go down and we're just going to check her genitals. Okay. So being that she's a girl, we're just checking to make sure the labia. I see a little meconium in here now. Make sure the labia majora is covering the clitoris. And you want to make sure that the labia majora and minora are both fully formed. If Miss Jane were a male, we would want to make sure the meatus is in the center and the location of the testes, and make sure that there is just ensure that there was no rugae on the scrotum. One thing I didn't mention was that we would want to make sure that Miss Jane wasn't having any discharge. So Mom, if you look, you see that there's no discharge there. Okay, so that is reassuring. All right, so next we're going to go down to the extremities. I see 10 toes and 10 fingers. She's got good muscle strength on each side, good muscle tone. They are equal lengths and everything like that. We're going to just look for some hip dislocation. I'm not seeing any. She's got good movement on both sides. All right, so now we're just going to go ahead and we're going to roll her over. And I'm just checking the spine for any openings, deformities such as that. I want to make sure it's all in line and no openings, okay? And while I'm here, I'm going to check for trunk incurvation, and I'm just going to run my finger down, and Jane will just kind of move all to that side, okay? All right, so we've assessed the suck and swallow reflex. We've assessed the trunk incurvation. We're going to go ahead and rub this side of her cheek, and she'll turn her head this way. That's going to be the rooting reflex. All right, and then if we turn her head to this side, we'll see that this arm comes midline and this arm comes in a fencing post. That's the tonic neck. And again, it'll be the same on this side, okay? All right, so the palmar flexion, if I just slide my hands in here, you see how our fingers wrap around my finger. That is the palmar, and the plantar, same thing. We're going to check the Babinski, so when I run my finger down her foot, her toes will curl up. We are going to assess the stepping. So we're going to pick Miss Jane up, and as we put her feet on the ground, you'll see her stepping. All right, that is good. And throughout this assessment, I have seen Miss Jane in the deep sleep when I first walked in. I have seen her in the quiet alert, an active alert, and an intense crying for behavioral. What you have been describing to me prior to this assessment is a light sleep and drowsy state. Stop it. That is going to conclude the newborn assessment. Mom, do you have any questions for me?
No.
All right, is there anything else I can do for you guys?
I don't think so.
All right, I hope Miss Jane has a good day and you as well, okay?
Thank you.
Bye-bye.